Welcome to LPN LaunchPad's review on complementary and alternative therapies. This comprehensive examination review covers various non-conventional treatment modalities that patients may utilize alongside traditional medical interventions. The nurse must understand these approaches to provide holistic care while recognizing potential interactions with conventional treatments. Knowledge of these therapies enables appropriate patient education and the integration of beneficial complementary practices into comprehensive care plans. Herbal therapy employs plant-based remedies to restore bodily balance and promote self-healing mechanisms. These interventions are commonly perceived as natural or gentle approaches to wellness, utilizing whole plants or extracts to address various health concerns. The nurse must recognize that herbal preparations can carry significant risks and interactions despite their natural origins. The perception of natural as inherently safe represents a dangerous misconception, requiring correction through evidence-based patient education regarding actual efficacy and potential hazards. Several herbal preparations demonstrate specific therapeutic applications requiring nursing awareness. Echinacea supports immune function and may prevent cold or flu symptoms. Ginkgo biloba enhances memory and improves circulation in some patients. Garlic supplements contribute to cardiovascular health and cholesterol reduction when taken consistently. Ginger alleviates nausea and supports digestive function. St. John's wort addresses mild to moderate depression through serotonergic mechanisms. Saw palmetto benefits prostate health in male patients. Ginseng reduces stress responses and enhances energy levels. Each herb presents unique considerations regarding dosage, preparation methods, and potential interactions with conventional medications. Herbal therapies present notable risks requiring nursing vigilance and intervention. Significant drug interactions occur frequently, exemplified by St. John's wort, reducing oral contraceptive effectiveness and potentially compromising birth control reliability. Additional concerns include potential toxicity and widely variable potency or purity due to limited regulation. The nurse must incorporate supplement assessment into comprehensive history taking, provide evidence-based education regarding known interactions, particularly with anticoagulants and psychiatric medications, and strongly discourage unverified or imported herbal preparations lacking quality control standards. Chiropractic therapy employs spinal and joint manipulation to realign structures, relieve pain, and improve functional capacity. This approach demonstrates particular efficacy for back and neck pain, addressing misalignments that may contribute to discomfort and functional limitations. Chiropractic interventions also benefit patients experiencing tension headaches through cervical spine adjustments. Joint disorders throughout the body may respond to specialized manipulation techniques designed to restore proper alignment and biomechanical function. Patient selection criteria and contraindication recognition remain essential to apply these interventions safely. Chiropractic interventions carry specific risks, warranting careful patient selection and practitioner qualification verification. Potential complications include muscle strain following adjustment and rare but serious injuries, such as fractures, in vulnerable populations. Absolute contraindications include osteoporosis, spinal tumors, and herniated discs, where manipulation may worsen the condition or cause neurological damage. The nurse must thoroughly assess musculoskeletal history before suggesting chiropractic referral. Emphasize the importance of licensed practitioners with appropriate credentials, and actively discourage chiropractic treatment in patients with high-risk comorbidities, where manipulation could exacerbate existing conditions. Acupuncture involves strategically placing fine needles at specific points along meridians to manipulate the energy flow known as qi, according to traditional Chinese medicine principles. This therapy demonstrates efficacy for chronic pain conditions, chemotherapy-induced nausea, migraine prevention, and arthritis symptom management. Potential risks include bruising at insertion sites, infection, if proper sterile technique is not maintained, and bleeding complications in patients with coagulation disorders or anticoagulant therapy. Evidence increasingly supports acupuncture's neurophysiological effects on pain perception pathways, providing a scientific basis for observed therapeutic benefits in specific conditions. Acupressure applies direct finger pressure to the same acupoints utilized in acupuncture without breaking the skin barrier. This non-invasive approach provides benefits for pain relief, anxiety reduction, and nausea management without needle-associated risks. The nurse should verify practitioner licensure and credentials before recommending acupressure services to ensure appropriate technique and knowledge. Patient education must include guidance on distinguishing normal sensations, such as mild pressure, tingling, or warmth, from concerning symptoms. like severe pain that might indicate improper technique. Acupressure offers a beneficial alternative for patients with needle phobias or bleeding risks who cannot undergo traditional acupuncture. Energy field therapies aim to balance or channel the body's proposed energy fields to promote healing and relaxation without direct physical intervention. Common modalities include healing touch, therapeutic touch, and Reiki, each using slightly different approaches to energy manipulation. These interventions present minimal physical risk while offering many recipients subjective comfort and relaxation benefits. The nurse must obtain informed consent before initiating touch therapies and respect diverse cultural and personal beliefs regarding energy concepts. These approaches may benefit palliative care settings, where symptom management and comfort promotion represent primary goals. Therapeutic massage involves systematic manipulation of soft tissues to reduce muscular tension, alleviate anxiety, and manage pain through various techniques and pressure intensities. Common approaches include Swedish massage for general relaxation, deep tissue work for chronic muscle tension, and specialized techniques for specific conditions. Contraindications warrant careful consideration, including avoidance in patients with bleeding disorders, deep vein thrombosis, or active infections, where manipulation could exacerbate the condition. The nurse must assess these contraindications before recommending massage therapy and advise patients to seek treatment only from licensed massage therapists with proper training and certification to ensure safe and effective intervention. Aromatherapy employs concentrated plant essential oils to address mood disturbances, pain, and stress through olfactory stimulation and topical application. Administration methods include direct inhalation, diffusion into ambient air, and diluted topical application for localized effects. Risk factors include allergic reactions, respiratory irritation in sensitive individuals, and potential teratogenic effects during pregnancy with specific oils. Before recommending aromatherapy interventions, the nurse should screen patients for asthma, eczema, and pregnancy. Education must emphasize proper dilution of oils for topical use to prevent skin irritation and sensitization, particularly with potent oils that can cause chemical burns if applied undiluted. Reflexology applies targeted pressure to specific feet, hands, or ear points, corresponding to discrete body systems and organs. Benefits include improved circulation to extremities, general stress reduction, and relaxation promotion through parasympathetic nervous system activation. Risks remain minimal, though practitioners should exercise caution with foot injuries, peripheral neuropathy, or vascular insufficiency. The nurse should refer patients only to certified reflexology practitioners with appropriate training, rather than those offering untested technique variations. Assessment must include evaluating conditions affecting extremities that might contraindicate pressure application or create discomfort during treatment sessions. Magnet therapy utilizes static magnetic fields to theoretically relieve pain and stimulate healing through proposed mechanisms, including increased blood flow or stimulation of acupuncture points. This modality carries specific contraindications requiring strict screening protocols before implementation. Magnetic fields contraindicate use with implanted electronic devices, including pacemakers, defibrillators, and insulin pumps, where interference could cause malfunction. The nurse must thoroughly screen for implanted devices before suggesting magnetic therapies and exercise particular caution with patients experiencing neuromuscular conditions where magnetic fields might theoretically influence nerve conduction or muscle activity through electromagnetic principles. Imagery and relaxation techniques employ cognitive approaches to promote healing and reduce stress through physiological pathway modulation. Guided imagery involves visualizing calming or healing scenes to reduce sympathetic nervous system activation. Complementary relaxation therapies include deep breathing exercises, progressive muscle relaxation, and mindfulness practices to diminish stress responses. These interventions present minimal risks beyond initial difficulty with focus or technique implementation. The nurse provides guidance tailored to patient preferences and cognitive abilities, often combining these approaches with music therapy or aromatherapy to enhance effectiveness through multisensory engagement and create comprehensive stress management protocols. Yoga combines physical postures, breathing techniques, and meditation components to create a comprehensive mind-body practice with multiple therapeutic applications. Benefits include enhanced flexibility, increased strength, improved mental focus, and significant stress reduction through parasympathetic activation. Certain poses may need to be modified or avoided for specific conditions, including glaucoma, hernias, and spinal pathologies. Increased intraocular pressure or inappropriate spinal flexion and extension could exacerbate existing conditions. The nurse should suggest beginning with basic level classes under certified instructors who can monitor technique and provide appropriate modifications. Patient education must emphasize respecting physical limitations and avoiding competitive approaches that might lead to injury. Complementary therapies require specific nursing considerations to ensure patient safety and optimal integration with conventional care. Herbal therapy necessitates vigilance regarding potential interactions and recognition of inconsistent potency due to limited regulation. Chiropractic interventions demand careful screening for contraindications like osteoporosis and disc pathologies. Acupuncture and acupressure require practitioner validation and monitoring for bleeding risks in vulnerable populations. When properly implemented by qualified practitioners, energy field therapies, massage, aromatherapy, and reflexology present minimal harm. Magnet therapy, guided imagery, and yoga require assessment for specific contraindications and appropriate adaptation to individual patient abilities, ensuring therapeutic benefit without unnecessary risk. A patient taking warfarin also begins using high doses of garlic. Which is the most likely outcome of this combination? Option A, no significant effect, as garlic is a natural herb. Option B, elevated blood sugar levels. Option C, increased risk of bleeding. Option D, reduced effectiveness of warfarin. When selecting the answer, consider garlic's pharmacological properties and potential interaction with anticoagulant medications. The correct answer is C, increased risk of bleeding. Garlic contains compounds that potentiate warfarin's anticoagulant effect through similar mechanisms, creating an additive effect that increases bleeding risk. This interaction exemplifies why natural substances still possess pharmacological activity, requiring the same monitoring and precautions as conventional medications. Patients often fail to report herbal supplement use, assuming natural products cannot interact with prescription medications. This dangerous misconception highlights the importance of comprehensive medication reconciliation that specifically addresses complementary therapies and over the counter supplements. A pregnant patient is considering aromatherapy with specific essential oils for stress relief. What is the best nursing advice? Option A, aromatherapy is always safe in pregnancy, so no worries. Option B, use any oil you like. If it's natural, it can't harm the baby. Option C, some oils can cause complications. Use diluted forms and verify safety. Option D, topical application of full-strength oils poses no risk. Evaluate each response considering safety principles for pregnant patients using complementary therapies. The correct answer is C. Some oils can cause complications. Use diluted forms and verify safety. Certain essential oils contain compounds with documented teratogenic effects or properties that can stimulate uterine contractions, potentially harming fetal development or triggering premature labor. Proper dilution reduces risk while still providing therapeutic benefits. Evidence-based practice requires verification of individual oil safety during pregnancy through reliable resources, rather than assuming all natural products are inherently safe. This precautionary approach balances the potential stress reduction benefits of aromatherapy with appropriate safety measures to protect maternal and fetal well-being. Which statement by a patient indicates a correct understanding of CAM's role in their care plan? Option A, I'll replace my antibiotics with acupuncture. Option B, I can use herbal supplements without telling my nurse. Option C, complementary therapies are used along with my medications. Option D, if yoga doesn't cure me, I'll try the doctor's plan. Consider the definition and appropriate implementation of complementary therapies when selecting the answer that demonstrates accurate patient understanding. The correct answer is C. Complementary therapies are used along with my medications. This statement correctly identifies the fundamental principle of complementary approaches as adjunctive rather than alternative to conventional treatment. Options A and D represent dangerous misconceptions, where evidence-based interventions might be delayed or abandoned in favor of unproven therapies, potentially allowing disease progression. Option B illustrates the common but hazardous practice of concealing supplement use from healthcare providers, preventing appropriate monitoring for interactions or adverse effects. The nurse must emphasize that complementary therapies optimize rather than replace conventional interventions for most medical conditions. Complementary and alternative therapies continue gaining popularity as patients seek holistic approaches to healthcare. The nurse must develop competence in assessing these practices, recognizing potential benefits while identifying risks and contraindications for specific patient populations. Documentation of all complementary therapies represents an essential component of comprehensive assessment. Questions about particular therapies or integration strategies can be placed in the comment section below, where LPN LaunchPad will provide evidence-based responses. Please support the LPN LaunchPad project by liking, commenting, and subscribing to access future content on topics essential for nursing practice and examination preparation. Hey there, this is Brian, the creator of LPN LaunchPad. I aim to give every student a fair review for the NCLEX for free using YouTube videos that can be watched or listened to without losing value. It may be free, but it is still valuable. If you find these reviews helpful, help me keep this project alive by hitting the like and subscribe buttons and continuing to watch my videos. Also, check out the free ChatGPT NCLEX review quizzes I have made to accompany these videos. A link is in the description or search for LPN LaunchPad in the Explore GPT box. This review has been an LPN LaunchPad production. We care for our future nurses by freely sharing knowledge.